how do we use peptides in functional medicine? I'm Joya Van Der Laan. I am a family nurse practitioner and also a functional medicine expert, specialist, and owner here at Nourish House Calls. Peptides are very short chains of amino acids, whereas proteins are made up of longer chains of amino acids. And depending on the order and the structure, these peptides act as signaling molecules, signaling for certain things, anywhere from signaling the pituitary or the pineal gland to work better, or the thyroid to work better, or to signal for improved muscle growth and recovery, or decreased inflammation. A good example of a peptide that's well known is insulin. Insulin is a peptide. Other peptides that are becoming more well known now are BPC-157, CJC-Ipamorelin, even the Semaglutide, tirzepatide, retatrutide, those GLP-1s are peptides. Peptides can be a really powerful addition to somebody's functional medicine arsenal or their plan. And the reason I say that is we do a lot of testing that we can figure out what you're deficient in, what kinds of foods you should and shouldn't be eating. We can talk about, nutrition and about exercise and sleep and stress. And sometimes a patient needs that extra boost of a peptide, or they want to get feeling better faster, or they want to do more things to yield good results and use them as preventative measures too. Peptides don't have to be a part of a functional medicine plan, but they're really useful in situations, especially when things are stubborn. I'll use them often in leaky gut, for example, where we'll use a peptide called lorazepam, sometimes along with a KPV and a BPC-157 to treat the whole gut and kind of seal up those tight junctions. Oftentimes I'll run into inflammatory conditions or pain conditions, tissue damage conditions that just are not quite healing on their own. In those cases, things like BPC-157, TB4 or TB500 can be super helpful. And you really want somebody who's knowledgeable about peptides and their uses and even how to combine them for synergistic effects. You really want somebody who's knowledgeable about that, prescribing these peptides. Please do not get them online. There are kind of disaster stories about literally people making them in their basement. So find somebody who knows what they're talking about and get them from a pharmacy, a good source, not a basement peptide maker. When I use peptides, I almost always layer them in as a secondary layer, because we need foundation first. Peptides are going to work usually no matter what if they're used correctly. However, if you are deficient in B vitamins or magnesium or minerals or other essential nutrients, the peptides are not going to work as well. Remember, peptides are signaling molecules, and so they're not going to correct any deficiency. They're not miracle workers, although it sometimes feels like that. So we want to make sure somebody's foundations are strong before we go throwing peptides at everything. Even in the case of, for instance, CJC-Ipamorelin or sermorelin, tesamorelin, which can help with weight loss, if you don't know exactly how to take that, it will not work. If you take those things with food, they can actually backfire on you a little bit. So it's important, again, to work with somebody who really understands peptides, how to use them, how to combine them, and how to prescribe them safely and effectively. You don't want to spend all that money on peptides and then be using them wrong. So I've mentioned a couple of my favorite peptides already, but I'll mention a couple more. TA1 or thymosin alpha-1, really, really great for immune regulation and also thymus kind of regulation. And so this is really good for either if you're getting sick, COVID or other viruses, or if there's any autoimmunity going on. I'll often use this as part of a functional medicine plan for somebody. GHKCU is another peptide I use often, both for hair regrowth and for skin conditions. There are serums that we can put on our face that contain GHKCU and even some zinc thymulin in there for added anti-aging benefit. I've been using the peptide on my face for quite some time, and I kind of rotate between different ones. But I've been really happy, and the patients who've used this GHKCU, zinc thymulin peptide, it has a few other things in it, have, essentially we'll say this, they don't want to run out of it now. They want to make sure that I can order it for them regularly. Epitalon is another of those peptides that we've had a little bit of trouble getting, but there are sources, clean, safe sources that we can get it from that actually helps with circadian rhythm and anti-aging. So another really nice peptide to use. Even if somebody's having trouble sleep, we can use Epitalon nicely. People are all about kind of bashing the GLP-1s. Now, while I think that there are definitely clinics out there using them in the wrong way, overdoing it, not talking about the importance of weight training, so muscle building, and getting enough protein in, getting enough hydration in, there are definitely those prescribing it in a kind of wrong way, I would say. I love the GLP-1s and the different generations of them too. And I've used all three of them in practice. So semaglutide, tirzepatide, retatrutide. And the one thing that I think people don't understand is how powerfully anti-inflammatory they can be. I've had several patients now, one in her 30s, who just had joint pain and just kind of felt inflamed, is how she reported it. She couldn't quite pinpoint. It was the elbows, it was the knees, the hips, it was kind of everywhere. She just felt inflamed. She also had a little bit of weight to lose. And so both of those things together, and the fact that she didn't have risk factors for any reactivity to the GLP-1s, we put her on one. And I usually always start at low doses, because I want to give somebody the lowest effective dose and do not want my patients to be nauseous, throwing up, anything like that from these GLP-1s. So she was on it within a week or two. She called me or messaged me, and her joint pains were gone. So pretty impressive results, especially that means now we're improving metabolic health. She's losing weight, doesn't need to be on any other anti-inflammatory medications or even supplements. So this can be really life-changing for people. And I probably have 8 to 10 patients or so for whom that was just a drastic change when they started semaglutide. Now, I've mentioned a lot of peptides. Please don't go out and buy all these peptides. Many of them work in synergy, but again, you really want somebody who's knowledgeable, educated, and experienced in using these peptides wisely. You know, there is an expense to them, and so you want to make sure that you're doing the right thing in the right combinations at the right times, and cycling in some cases for some peptides. So if peptides are something you're interested in, we can talk about using that as part of a whole functional medicine plan for you. If you live in a state where we are licensed, you can look at that on our contact page on the website. Feel free to give us a call. We can set up a discovery call with you, and you can actually book that link using the link below, so you can book your discovery call. We would be honored to help you, and we just love what we do over here at Nourish House Calls and love seeing people thrive in their lives.